We're going to cover the positive Deerfield. In the positive Deerfield, remember that the short leg is short in extension, and when we cross it up and bring it over, it gets long. Now, when we go to adjust that, we have to be on the side of the involvement, or you can do it from the other side, providing you maintain line of direction and line of correction. What we're going to do is that we're going to use our thenar, and we're going to place that on the PSIS on the patient's spine. The stabilization is usually an argumentative thing sometimes, depending on who you talk to and where they've learned what was going on. The stabilization basically with the drop table is on the posterior ischium. In the old days, Deerfield used to grab a hold of the pelvis and hold on it in that respect, but that was before the advent of the drop table. And of course, J. Clay, when he started using it on the drop table, found that using the posterior ischium was a little better from the standpoint that if you have an AS on the opposite side, and in many cases this is what happens because you have a PI on the other side, that's what a positive Deerfield is, you'll have an AS on the other side. So we want to set up with our thenar on the PSIS. Our stabilization is over the posterior ischium of the opposite side. We're standing a little bit inferior. Table drop is down and forward if you have that facility on your table, or just straight down. We're going to use the pelvis and the lumbar pieces. So let's set up here on Amanda. And we'll have our table set up with PL, lumbar and pelvic. And remember, we're going to set the table to the weight of the patient, turn the knob to the point where the table drops and turn it back about 2/3 of a turn. Place our contact hand on the contact point, stabilize, and thrust. And that's how you take care of a positive Deerfield on the drop table.